Good evening and welcome to Doctors on Call. Tonight we're talking about the diagnosis and treatment of skin issues like acne, eczema, skin cancer, and psoriasis. I'm your host, Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, Duluth. So what would you like to know about skin problems? Call those questions in locally at 218-788-2844 or toll free at 1-877-307-8762. Here to answer those questions are this evening's panelists. Dr. Heather Buchholz, a dermatologist with St. Luke's Dermatology Associates in Duluth. Dr. Chris Thiessen, a family medicine physician with Gateway Family Health Clinic in Moose Lake. And Dr. Michael Wolz, a dermatologist with Essentia Health-Duluth Clinic. Medical students answering phones tonight are Jolynn Azier from Minot, North Dakota, Grant Carlisle from Grand Rapids, Minnesota, and Kate Flinchbaugh from Byron, Minnesota. And now on to tonight's program on skin problems. Well, to start out, Dr. Buchholz, this is a common time of year for dry skin. Everybody's got itchy, dry skin, including me. So what do we do about it?
That's a great question. So for one thing for gentle skincare is to minimize the exposure to soaps, oftentimes using a milder soap like Dove or unscented.
So we don't need to quit taking showers or anything?
We don't need to quit showers, but when you shower, probably just make warm water, not super hot water, and then use soap only in limited surface areas of your body, like areas more prone to sweating. And then pat dry, and when you're still a little damp, it's good to put on a thick moisturizer head to toe in the wintertime. Usually within 3 minutes of jumping out of the shower is a good time frame to try to seal in the moisture from the shower.
And just over-the-counter moisturizers?
Thicker is better, and I try to ask patients to select things that are fragrance-free. Oftentimes a shorter ingredient list is better. Vanicream lotion is an excellent all-purpose moisturizer for adults and children too. Other than that, Eucerin is a great moisturizer. There's a lot of products out there now, but usually the simpler is better.
Great, thank you. Dr. Thiessen, another question that commonly comes up, I know in your office, is people come in with skin changes or moles, and when do we worry about moles?
Well, we worry about moles if they become asymmetric, so one half might look different from the other half, or if they get a change in color, or if the border starts to move, if it seems to start to creep somewhere else, or if they look dark black, if they become raised, or if they become bigger than the head of a pencil.
Well, thank you. And Dr. Wolz, a lot of these, some of these can be skin cancers. And if you have a skin cancer, what's the likelihood of you getting another one? Does that increase your risk for having another one at some time in the future?
Yeah, that's a great question. Something that I answer almost every day, actually, in practice. And you're asking a cutting-edge question, too, because a study just came out last year talking about this very problem. So the most common skin cancers are basal and squamous cell carcinoma. And the study that was published last year suggested that after the first skin cancer, you have about a 40% chance of getting another one within the next 2 years. So relatively high, which is why we recommend that patients after the first skin cancer be seen on a regular basis for skin cancer screening. After that, the risk decreases quite significantly, and if you don't have one for 2 years, then your risk goes down to almost 5%, which is like the general population in the elderly population. If you had more than one skin cancer, particularly basal and squamous cell, your risk goes up to almost 80% for another one in 2 years. So it's quite high if you have more than one, which is why we like to see our patients have skin cancer before to make sure we catch things early.
Great. Thank you. Dr. Buchholz, speaking of this, skin cancers, we have a caller from Duluth who would like to know what's the difference between a basal cell and a squamous skin cancer?
That's a great question. They're both very common types of skin cancer. Basal cell is the most common type of skin cancer. Typically that will look like a pink raised bump. Oftentimes patients will think it maybe was a pimple, but it just doesn't go away. It tends to persist. Oftentimes it can bleed with a little bit of trauma. A squamous cell skin cancer is the second most common type. It has a little bit increased risk of, well, it's a higher risk of skin cancer than a basal cell. It can metastasize, but not very often. The squamous cell carcinoma can often first present as being a scaly, dry patch. And then melanoma would be the more dangerous type of skin cancer, also the least common of those three. And that was kind of like Dr. Thiessen was talking about with changing mole, darker borders or altered borders, or a mole that has new symptoms, like it was never noted before, and suddenly it's kind of tender or itchy.
Okay. Thank you. Dr. Thiessen, a caller from Virginia, would like to know about hand eczema. That's another common one these days.
Yes.
She just uses hand cream now. Are there any prescriptions for eczema?
There are. Besides the hand cream, I would recommend, as Dr. Buchholz said, avoid the hot water and soaps. And a lot of people doing dishes seems to exacerbate the hand eczema. With hand eczema, there are creams that are very strong steroids. And then we have some people that seem to get better after antibiotics, though that's not something we like to do very often.
So the strong steroids, is that something you just use on a limited basis?
Yeah, and you'd be careful to keep them on the hands. Using them on other areas of the body with the very strong steroids can thin the skin. The hands have very thick skin that is somewhat protected against that.
Okay, thank you. Dr. Wolz, a caller from Duluth, would like to know about hemangiomas now. She apparently has had laser treatment and it's effective, but how many treatments can a person have, and are there side effects to laser treatment for hemangiomas?
Not that I'm aware of. I think it's a good treatment, and it depends a little bit what you mean with hemangioma. It's a pretty wide term, and there's little ones, or like the cherry angiomas, a little red spot that almost everybody has. They respond really well to treatment, and however many treatments it takes to make the person happy, I think. The larger hemangiomas that sort of are congenital may require a little bit more work. And usually it's good to see somebody who does that on a regular basis, those treatments, and they will guide, how many treatments are appropriate.
Okay, thank you. Dr. Buchholz, a caller from Duluth, would like to know about a high blood pressure medications that's being used for acne. Do you know anything about this?
Sure, there's a medication called spironolactone.
Oh.
It is effective for adult female acne specifically. I really like it, especially when you can kill two birds with a stone and the patient also has hypertension, because it's nice to simplify their medication regimen. But typically it can help a lot with acne that's been recalcitrant to other treatments. So it's failed topical retinoids like Retin-A. Sometimes it's a good alternative to using an oral antibiotic long term too, but it can work very well specifically for adult female acne.
I'm just curious myself, what's the mechanism of that? How does it work?
It's counteracting testosterone, aldosterone. So basically,
it's a hormonal thing.
Exactly, and it can help a lot, especially for adult female acne. It's oftentimes lateral face, lower cheeks, recalcitrant, kind of deeper pimples that come and stay for a longer period of time. It can work wonderfully. You want to make sure the patient's on birth control, though, because it does kind of counteract testosterone. So if the patient became pregnant while on it, potentially if it was a male fetus, he wouldn't develop normal male genitalia. So you need to be cognizant and make sure the patient is using birth control reliably.
That's also a medication that can be used to decrease dark hairs. So
Correct.
I suspect the same people are very happy about that side effect.
Right.
Very good, thank you. Dr. Thiessen, we have a caller from Duluth in his 80s who would like to know about, he has itchy shoulders and a neck, but he doesn't have any rash. How about just itchiness? That's a common one too.
That's really tough. At this time of year, if I've got somebody with itchiness, especially up in this area, I think that the moisturizing and trying to avoid overwashing the skin is probably the best. We have, I guess the last person that I had that came in with itchiness like that actually had it just on one side, and it was shingles. It was a new rash of shingles. There's lots of reasons that it could be.
Sure, thank you. Dr. Wolz, a caller from Two Harbors would like to know what's the best way to get rid of cold sores?
Oh, that's a good one too. Yeah, that's a good question. So there are some over-the-counter creams even that are available in pharmacies that are worth giving. Otherwise, there are some prescription antiviral medications that help. And finally, if an individual gets those frequently, we can give oral medications that are helpful too. the problem with all of these is that they have to be started pretty much before or at the time the lesions appear. So after they've been present for a while, they usually just have to run their course.
Thank you. Dr. Buchholz, a caller from Duluth, would like to know, he has a family history of skin cancer. Does that increase his risk of getting skin cancer?
Definitely. If there's a family history of skin cancer, especially melanoma, I typically ask that my new melanoma patients have all primary relatives screened for skin cancer. And by primary relative, that means any siblings you have, your parents, and your children. So, and then I think for basal and squamous cell, we do see family patterns, but typically I think a lot of it has to do with the complexion the patient inherits. If they're blue-eyed, red-haired, fair-skinned, they are going to be at increased risk for skin cancer. So,
Thank you. Dr. Thiessen, a caller from Chisholm, would like to know about, can light therapy supply vitamin D3?
Well,
Or what's the role of light in vitamin D?
light changes cholesterol into a precursor of vitamin D. And the problem with that is that that's a type of ultraviolet light that can be irritating, and in order to get it, you might have to increase your risk of skin cancer. So up here, we do recommend that people get vitamin D through the diet and try and get a good, healthy amount of sun without raising your risk of skin cancer by exposing yourself for a while, by not using good covering up with clothing or with a sunscreen.
Thank you. Let's see, Dr. Wolz. Oh, there was a caller here from Superior who would like to know about the Mohs procedure. Now, what's that?
Yeah, that's a good question too. And I do the Mohs surgery, so I'm very happy to answer this. So Mohs surgery is a form of micro surgery, or otherwise I like to call it real-time surgery, where we cut the cancer out and immediately process it and look at it to see whether there's any cancer left in the skin. And if there is, we can go back and make sure that all the cancer is gone. So the goal of the procedure really is to get rid of the cancer. A side effect which patients like is that the defect, the surgical defect, the hole we make essentially stays as small as possible. So it's a really excellent procedure. The main downside is it takes a little bit longer, and it's only approved for in certain areas of the body or certain size of tumors. But it's an excellent procedure with the highest cure rate we can offer in dermatology.
Do people have to have like plastic surgery afterwards sometimes if there's a bigger area that's been excised?
Yeah, sometimes they do, although we do a fair number of reconstructions ourselves. We do get some training in that, and some individuals we send to our colleagues in plastic surgery. Many we just able to repair ourselves.
Great, thank you. Dr. Buchholz, we have two callers here wondering about skin tags. Like, what are they? What's that all about? And why? And if they're taken out, if they're burned off or whatever, they can come back. So.
Sure. So skin tags are these little pedunculated pieces of skin, oftentimes seen in frictional areas like around the neck, under the arms, on the thighs. They're very common. They're not cancerous. They have no risk. They can be a nuisance, though. Sometimes they can get twisted and become painful. So skin tags can be treated with liquid nitrogen or frozen with liquid nitrogen to have them removed, or they oftentimes primary doctors will do that, or they could be snipped off. Sometimes also we see with weight gain that people have a tendency towards more skin tags. So sometimes it's a good reminder to try to keep the BMI lower and keep an active and healthy lifestyle to try to decrease the number of new skin tags developing.
Thank you. We've got a couple of callers wondering about psoriasis, so maybe we could start out with you, Dr. Thiessen. Just if somebody comes in with psoriasis to you, how do you start out treating them?
Well, there are different forms of psoriasis, and I'd say the most common will occur on areas that get some friction, like the elbows and knees, maybe the base of the spine, knuckles sometimes. That can also come up when you get skin damage in other ways, like a sunburn or a cut or something. So we do want to try and prevent damage to those areas of skin. The psoriasis is a red plaque with a lot of scale on top of it, and you can just over the counter use things that will soften the scale and make that easier. We often are using prescription medications in order to try and change that skin so that you don't grow quite as much of a skin, you don't have quite as much skin growth and scaling and flaking off of that. And that could be steroids, that can be a relative of vitamin D or a relative of vitamin A. And there are some more severe things that can, in severe cases of psoriasis, you can use correspondingly stronger medications that might affect the immune system to try and calm that down even further. I think you guys have more experience with that than I do.
Yeah, what are the new treatments for newest treatments for psoriasis?
Yeah, there are a number of new ones, and it seems like there are new ones coming out every day. The most recent one is a pill, which we haven't had for a long time, except for an old treatment that has been available for some time. But most of them are immunosuppressants, like you rightly mentioned. Phototherapy is another good one that usually we do before we do any pills. But the newest one that people are often talking about is those biologics, and those are also the ones you see the advertisements for on TV. It's often hard to get them first. First, you usually have to jump through some hoops of other things. But yeah, there are a number of good treatments that work really well. The only thing I would add quickly about psoriasis, if I may, is that another new thing is that lifestyle is actually a very big factor in psoriasis. And there are some studies that have been shown that just simple changes to your lifestyle, such as exercise and weight loss, can lead to significant improvement in psoriasis and reduce the risk of cardiovascular disease, which is actually higher in psoriasis than in other people.
Thank you. Dr. Buchholz, a caller from Ely would like to know what kind of treatment is recommended for granuloma annulare.
Oh, interesting. So granuloma annulare.
Yeah, what is it?
It's I guess you would put it in the inflammatory category. So it's technically a rash, but it can look like red to purple, raised, oftentimes rings, oftentimes on the dorsum of the hands, the back of the hands, the back of the feet. And there's some variants where it can be much more widespread. Oftentimes it's asymptomatic, no itching, but sometimes people can have some pretty burdensome itching. Topically, you can use higher potency steroids. So prescription topical steroids can be used to the sites. If it's more widespread, sometimes we'll even use immunosuppressant medications, not all that dissimilar to how we treat psoriasis with methotrexate or even light therapy in some recalcitrant cases. But typically, people respond quite well to topical steroids. We don't know what causes it.
Okay, sure. Interesting. And speaking of what causes things, Dr. Thiessen, a caller, great question. What causes acne?
Oh, well, there's lots of things. There are bacteria on the skin that cause acne. I believe the bacteria like the oils on the skin, and so if you try and help keep the oil down, that tends to help the acne a bit. As Dr. Buchholz mentioned, the hormones in the body can affect how the skin works. They can make the pores more likely to close and to provide an environment where the oil and the bacteria can grow to cause inflammation. Can you guys think of any others?
There's been some publications more recently talking about diet, and we've always gone around and around with that, where patients come in and say, oh, chocolate or French fries or whatever it is causes my acne, and we hadn't had any evidence to really support that. But now there have been some studies showing that diets that have a higher glycemic load, so more carbohydrates and processed foods, can increase the risk of acne. And in some studies, I think it was in a Korean study looking at dairy specifically, and that in some populations dairy can seem to worsen acne. So in general, it's a good reminder to try to eat a healthy diet and try to minimize the amount of processed foods and fast foods.
Interesting.
And I would add that certain medications can do it too, like steroids are a classic one. It's called steroid-induced acne. So sometimes in adults that suddenly develop acne, it's worthwhile checking the medication list.
Thank you. Dr. Wolz, a caller from Superior had a biopsy and was told it was scleroderma. So how do you control that?
Oh, that's a tough one, actually, and a good question. So scleroderma is basically systemic disease, as we like to say. There's a localized form called morphea, where basically the skin just becomes almost scar-like. And the local form, if it's only in small areas of the body, we can treat locally with topical steroids, with injections. If it's scleroderma, it usually means it's more widespread. And often we have to work as a team, including with our family medicine doctors, rheumatologists, sometimes if the joints are affected. And we often need to resort to systemic medications like methotrexate or immunosuppressants to control the disease.
Thank you. Dr. Buchholz, a caller from Duluth would like to ask you a question specifically about how does cream work on precancer cells on the face?
We have a couple of different options. First, you have to select the right type of cancer. So it has to be a superficial form of cancer or even a pre-cancer, like an actinic keratosis. And we have a medication called 5-fluorouracil, which basically acts to kind of incite an immune response so that your body gets a little bit more red and irritation, and it helps to fight off the cancer itself. Imiquimod is also used, which acts on something called a toll-like receptor. But basically all of these creams are something that you apply at home topically for a period of time, and that varies depending on how much irritation you get or what type of cancer it is. And oftentimes there'll be a period of time where you will look a little red and irritated, or like you fell down a gravel road, because it can be a tough treatment. Sometimes when my patients are in the middle of treatment, they'll have other people come out of the woodwork and say, I know what you're using, because they have done it themselves. So there's some good options, but you need to make sure that it's a superficial form of cancer that's appropriate for treatment, and that you can have the treatment course monitored to make sure that you get a good response.
Thank you. Dr. Thiessen, we've been talking about acne, and basically we've been talking about acne vulgaris, but now a caller calls in about acne rosacea, which is,
sure.
and is that something that goes away, or is it?
Well, as people get older, you tend to go from the acne vulgaris as a teenager to acne rosacea, and there are a couple differences. It can involve blood vessels that are dilated in the skin. So you can have more redness even if you don't have the pustule pimples that people often have as a teenager. It can affect the eyes, and we often use antibiotics either as a cream or as an oral treatment in taking care of people with acne rosacea.
Well, thank you. Dr. Wolz, a caller from Virginia. We have a lot of callers from Virginia tonight. Must be a lot of skin things going on up there, by which they are everywhere. But anyway, he would like to know about lichen planus, and what is that?
Yeah, that's a good question too. Relatively common disease. It's an inflammatory disease, and it's often described as the P disease because it's purple, polygonal, and pruritic, meaning itchy.
Remember that.
It usually it can affect almost any part of the body. It can even affect the scalp and lead to in a certain form of the disease can lead to hair loss. It can affect the mouth, but typically it's just seen on the skin. And we treat it in the first instance with topical corticosteroids, but sometimes we need to resort to stronger medications.
Thank you.
I'll also bring up there, I had a patient bring to me a treatment of just using a once-a-week injection of a blood thinner in a very low dose. And this is a form of immunotherapy that worked very well for this patient who could just give an injection at home and didn't give you quite the same concerning amounts of immune therapy that we might get in other ways.
Well, thank you. Let's see, Dr. Buchholz. Oh, this is a good question from Superior. There's over-the-counter skin tightening treatments and laser therapy for us to all look young again. Does any of that stuff work?
Wow, I think the two proven things to help preserve a youthful appearance would probably be sun protection and not smoking. So those are probably the best places to start. You can do topical retinoids or retinol or retinoic acid. You can buy in a milder form over the counter. Sometimes it can cause some dryness or irritation, so those are the main side effects to watch out for. There are quite a few different potions promising quite a few things. I would stick with the sunscreen, avoiding smoking, trying to get good sleep and have good nutrition. But certainly laser treatment can work well for treating sunspots, for redness, dilated blood vessels of rosacea. So there are a lot of different things that you can do, but I wouldn't spend a ton of money on a potion promising too many things that's advertised and
it's nice to work with professionals in that context too, because the laser treatments do work pretty well, as long as it's done by somebody with some experience with it. You can resurface the face. You just have to make sure the patient is aware of what's going to happen. They're going to have some downtime afterwards, and what to expect in that context.
Okay. Well, thank you very much. Well, we're at the end of our half an hour here. It went really quickly. We had a lot of great questions and some left over. I'd like to thank our panelists, Dr. Heather Buchholz, Dr. Chris Thiessen, and Dr. Michael Wolz, and our medical students, Jolynn Azure, Grant Carlisle, and Kate Flinchbaugh. Please join me again next week. I'll be here again next week for a program on lung problems, when my panelists will be Dr. Vance Buchholz, Dr. Sonia Burke, and Dr. Emily Onello. Thank you for watching, and good night.